The fifth lesson deals with the topic getting on with life, respectively living with Parkinson's. Parkinson's disease may impact on your day-to-day life and make some daily routines more burdensome. However, having a positive attitude to life and maintaining an active daily routine is vital for helping to manage your Parkinson's disease in the long term. In detail, the following points are discussed here. Practical tips around the house. Getting a good night's sleep. Dealing with emotions, stress and depression. Problems with thinking, reasoning and remembering. Economic and social burden, and respecting family caregivers. First of all, some practical tips around the house. There are many simple tips to overcome the nuisance caused by the effects of Parkinson's disease and to help with day-to-day life around the house. Always organize your daily routine so that you have plenty of time to undertake activities. With Parkinson's disease, movement may not be so automatic, so break tasks down into their component parts and do each stage consciously. If something is proving difficult to achieve, stop and try again after a break. Make use of simple aids that make daily life easier. Computer users may find voice-activated software is more convenient than using a keyboard. Sticky keys and toggle keys can help overcome problems with pronounced tremor. You should ensure the environment is safe, with good lighting and no loose mats, training electric cables, raised door sills or unnecessary clutter. It is valuable to learn how to get up off the ground in case you have a fall. Avoid armchairs or settees that are too low or too soft. A chair with a straight back, high seat and arm rests is best. Use a non-slip bath mat and have suitable grab rails fitted in the bathroom and toilet. Empty the bath before stepping out of it. A raised toilet seat is often helpful. Do not lock the bathroom or toilet door if you may need help. Instead, you can ensure privacy by having a notice on the outside saying occupied or free. Let's discuss now about getting a good night's sleep. Disturbed sleep disrupts the lives of most people with Parkinson's disease and their families. Less sleep at night can in turn lead to general fatigue and daytime drowsiness. You may nod off as soon as you sit down during the day and yet wake frequently during the night. There are many possible causes. Parkinsonian symptoms of stiffness, tremor, cramp, and difficulty turning over in bed may make sleep difficult. Drug treatment for Parkinson's disease itself may cause side effects of insomnia. Nightmares and hallucinations, as well as daytime drowsiness, associated conditions of depression, dementia, restless legs, sleep apnea or need to pass urine may disrupt sleep. You should follow general advice that helps to promote a good night's sleep. This includes keeping as active as possible during the day with adequate exposure to sunlight, avoiding a high fluid intake and stimulants such as coffee and tea in the evening, establishing a bedtime routine, possibly including a warm bath and a milky drink before going to bed, and ensuring the room itself is quiet, warm and comfortable. Appropriate choice and timing of drugs for Parkinson's disease is important. Longer-acting levodopa preparations may help, or an extra rapid onset preparation taken during the night. Turning in bed can often be a problem. It is easier to turn on a firm mattress. If the mattress is soft, you may want to place a board underneath it. If you are experiencing problems with going to the toilet at night, proper diagnosis is important to guide the correct choice of treatment. If problems persist, you may want to consider a bedside commode or portable non-spill urinal. A good night's sleep, or even an afternoon nap, seems to benefit symptoms of Parkinson's disease, with most people reporting the morning as their best time of day. We go on to dealing with emotions, stress and depression. Even everyday situations can become stressful for people with Parkinson's disease. For example, when you need to sign your name quickly in front of others, when you go to pay at the supermarket, or when getting on or off public transport. The more stressed you are, the worse your symptoms of tremor, rigidity and unsteadiness will be, and this in turn makes it more difficult to cope. The well-being of people with Parkinson's disease and their ability to cope is greatly influenced by their psychological reaction to their condition. A positive attitude is essential if you are to maintain self-esteem, keep in good spirits and get the most out of life. A thorough understanding of the nature of Parkinson's disease and its effects will help you to maintain self-esteem, dispel unreasonable fears, reduce stress and promote independence. Active involvement in all decisions about the treatment of your Parkinson's disease will ensure that you feel more in control and so more confident about the future. The graphic shows different ways to cope with emotions, stress and anxiety. There are many approaches you can use to reduce stress. It is important that you allow yourself plenty of time and do not need to rush. Feelings of low mood and anxiety are common in people with Parkinson's disease. They can develop at any stage and seem to be related more to the underlying chemical changes in the brain, rather than a reaction to the problems it can cause. Depression can be helped a great deal by appropriate medical and psychological treatment. Discussing your fears and concerns with professionals can help to identify ways to cope with them and lead you to develop a more positive outlook. Antidepressant drugs, though not effective immediately, can be useful in many cases. Speech problems, reduced body language and slower thinking associated with Parkinson's disease can have a big impact on your social life and lead to loneliness and isolation. You should try to maintain an active social network and replace lost social contacts with new ones. Sexual and family relationships can also suffer. Don't hesitate to discuss openly your concerns about changing personal relationships with those close to you. Both sides can then make any necessary adjustments to ensure a continuing and fulfilling relationship. Let's see the problems with thinking, reasoning and remembering. You should not jump to the conclusion that any problem with your memory or thinking is due to Parkinson's disease. Everybody takes longer to react and to remember things as they get older. Drug treatment for Parkinson's and for other conditions, depression, infections and metabolic upsets are common causes of confusion and are easily treatable. People with Parkinson's disease can develop other conditions, such as stroke and Alzheimer's disease, in the same way as anyone else. When visual hallucinations and confusion develop within a few months of onset of Parkinsonism, the diagnosis may be a condition called dementia with Lewy bodies or DLB, rather than Parkinson's disease. Some authorities think that DLB and Parkinson's disease with dementia are the same condition. Both groups of patients may benefit from the new cholinergic drugs developed for Alzheimer's disease. Cognitive changes can be very frustrating, but are seldom disabling. Only a minority, perhaps 20% of people with Parkinson's disease, have more significant problems of dementia that interfere with quality of life. The most common cognitive changes include slowed ability to think and process information. You may find it difficult to come up with new ways of solving problems and to change from one subject to another. While changes in memory are less frequent, people with Parkinson's disease tend to forget where and when information was obtained but remember the information itself. You may recall information much better if given cues, or multiple choices to select from. You are likely to be worse when you are anxious, tired or hurried. You can make life easier by always allowing yourself plenty of time and avoiding stressful situations. Hallucinations, usually taking the form of seeing people or animals that are not there, and delusions, believing things that are not true, can be related to Parkinson's disease or to Parkinson's medication. A change in dose, or of drug, may be sufficient for them to disappear. The development of more serious memory and thinking problems leading to dementia can be easily overlooked. Family and carers can wrongly attribute the slow development of unreliability and behavioral changes to intentional behavior and laziness. Misunderstanding can then lead to resentment and frustration. But what is the economic and social burden? Make an extra effort to maintain social contacts with family and friends, so that you do not become isolated and lonely. Even if at times you feel low and discouraged, try not to let others, including your family and your doctors, take over and make important decisions for you. Playing an active part in managing your Parkinson's disease will help to maintain the best possible quality of life. Being able to continue to drive is very important for many people with Parkinson's disease. Most continue to drive for many years after diagnosis, however it all depends on your health and on local rules and regulations. Power steering or automatic gears may be helpful. People with conditions such as Parkinson's disease can incur extra expenses due to their special needs for treatment, care or equipment. For this reason, there are a number of financial benefits available, to which you may be entitled. Some of these extra benefits are available dependent solely on your disability, regardless of your other income and savings. Other benefits are means tested, so eligibility will depend on your income and savings. If your Parkinson's disease or general condition means that you need help with personal care or need someone around constantly to ensure safety, then you might be entitled to the attendance allowance. Depending on your income, a carer allowance may be available. Please pay attention that these allowances are country-specific. You should discuss possible options with the local Social Security office. If you have difficulties collecting your pension or benefits, you can inform the local benefits agency of someone who will collect them on your behalf. This person must be an authorized agent. Appointing an enduring power of attorney is a sensible move for any older person with a progressive disabling condition. This allows an attorney or attorneys to carry out any specified financial or legal transactions on your behalf, and this authority continues even if you become unable to act for yourself, for example due to mental or physical frailty. An enduring power of attorney must be drawn up, at best done by a solicitor, and signed whilst you are fit and able to understand fully what you are doing. Living will is an important statement for the future, and it will be discussed in Lesson 7. Finally, we will discuss about respecting family caregivers. Respecting family caregivers, who are the greatest support of patients in Parkinson's disease, especially when they wish to be cared for at home, is very important. Lesson 6 covers the importance of respecting and supporting the family caregivers in detail. If you are concerned about the intensity of medical intervention should you become very disabled, for example use of artificial feeding or resuscitation procedures, then you might consider making an advance directive, or living will, which is discussed in Lesson 7. Medical staff and relatives would then have to consider your previously expressed wishes when making management decisions.